Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Summertime is here, finally. And the 4th of July holiday, it's not too far away either. And summer means that kids are out of school and it's time for fun in the sun and family vacations. Summer activities like biking, swimming, boating, or even riding a four-wheeler. You got one of those?
No.
One for your kids,
No.
I bet. Riding a four-wheeler can be a lot of fun, but they also require some common sense and a little caution to stay safe and healthy.
Emergency departments are busy during summer months as kids and adults are more active, which means more injuries.
Yep.
Here to discuss summertime safety is Mayo Clinic emergency medicine physician, Dr. Luke Wood. Welcome to the program, Dr. Wood. It's nice to meet you.
Thanks for having me.
Dr. Luke Wood, so great to have you on the program. Your father and I worked together for so many years, and your mom and dad have been friends of mine for so long. And you worked in the emergency room back in what year? I'm not in the emergency room, sorry, the operating room.
Yeah, that was 1999 and 2000, I think.
Yeah, amazing. Then you went to medical school after that.
I did, yeah.
And where'd you go?
I went to University of New England.
And good?
Yep.
And then you stayed out there and were practicing in the emergency room out there for a while?
Yeah, I did my emergency medicine residency out in Portland, Maine, and then I was out in practice out there for about 4 years.
How did you choose emergency medicine?
I liked the variety of kind of the different things that you saw. You kind of took care of the whole person and everything from, injured toes to psychiatric emergencies and everything in between.
And the other good thing about it, too, isn't it, is the regular hours. I mean, you work
sure.
at 8 or 10 or 12-hour shift, and you're done. You don't have to worry about them when you go home because somebody else is taking them over.
Well, the shift work is a part of it. It doesn't always really jive with your circadian rhythm necessarily, but...
So you work different shifts.
Correct.
So you might work overnight, and then you might work during the day, and 12-hour shifts usually, 10 or 12?
I work both here in Rochester and over in Red Wing, and so in the community sites, oftentimes you do a little bit longer shifts, like 12 hours. Here in Rochester, where it's kind of busy around the clock, we typically do 8 and 9 hour shifts.
Okay, I have one really important question before we get started with the meat of this program and safety in the summer, and that is, how come you have to wait so long in the emergency room?
Right off the bat. Welcome to the program.
We want to hear it right from the horse's mouth. What are you doing back there?
It's a popular place to be, especially during the summertime. Unfortunately, in the summer months, we always see a surge in patient volume, so that typically correlates with a little bit longer waiting times. But we try to do our best to kind of move people through and kind of sort out the really sick people from people who might just need a quick evaluation.
And that's a big part of the problem, isn't it? There are a lot of people who are there who don't have a true emergency.
True, yeah, and the causes for that are pretty complex. Probably a little bit beyond our time here, but that's true. We see kind of a lot of primary care issues in the emergency department as well as true emergencies.
I just wanted to reassure our listeners that you truly are not back there eating donuts and watching
No, it's
soap operas. I mean, I know you guys are doing your best back there, but sometimes truly it does get very frustrating being a patient waiting so long.
There are definitely fewer soap operas being viewed than in the summer where we work together.
All right, so let's talk about summertime. I would imagine that no matter what the season is, in the wintertime, you've probably got other issues that people come to the emergency department for, but is summertime the most active at the ER?
Typically speaking, I mean, if you look at emergency department volumes across the country, I would say that most emergency departments are going to see a surge in summer volume. It's probably a little bit different when you're kind of in the mountains of Colorado and that type of thing, where they get more of kind of a winter tourism. But here in the upper Midwest, summers are definitely the busiest time of year for us in the emergency department.
And what are you seeing? What's a typical day for you? The most common things that you see?
Well, I mean, typically in the emergency department, just regardless of the season, you see your fair amount of, shortness of breath, abdominal pain, chest pain, that type of thing. Kind of in the summertime in particular, you're seeing a bit more of people kind of getting injured or becoming sick because of exposure to some outdoor elements that they're maybe not totally prepared for. Everything from sunburn to dehydration. We see kind of an increase in traumatic-related injuries during the summer because people are out just on the roads more often. Oftentimes people are imbibing to different degrees as well, which can certainly affect rates of traumatic injuries. And so during the summer, we always see kind of an increase in both kind of more mild injuries related to summertime activities, tick bites, running into poison ivy, contact dermatitis, that type of thing, and then more serious thing like car accidents and ATV accidents.
Motorcycles?
Motorcycles too.
You don't have a motorcycle, do you?
I do not own a motorcycle, no.
Do you know any emergency room physician who does? Maybe.
Maybe.
Yeah, but you don't have to work there very long to know you don't want a motorcycle, and you want your kids to have a motorcycle.
Got it.
Yeah, it's not, ooh.
I would think that
Bring back some bad memories.
that's good advice right there. I would think that because it is summertime, that heat-related issues are some of the things that you see people about the most, or not?
Absolutely. Yeah, I mean, that's a very common complaint that we see in the emergency department, and oftentimes it's kind of a double-headed monster where there's kind of the exposure to heat and then some degree of dehydration, and that can affect different people to kind of varying degrees, especially in kind of the elderly population, we'll see kind of an increase in heat-related complaints like dehydration or heat stroke itself.
Do I remember that if for children and the elderly, the problem is that they don't feel, their body isn't able to monitor the effect of heat like adults can.
Yeah, I mean, it's probably for a variety of reasons. I mean, one reason for that is that kind of the extremes of age just aren't able to communicate some of their symptoms, and so kind of some of the vague symptoms that go along with heat exhaustion or heat stroke, like dizziness or confusion, you might not really pick up on as much as somebody who's otherwise able to tell you kind of all the symptoms that they're feeling.
So what's the treatment? What do you do if somebody comes in with a heat stroke, heat exhaustion? Obviously, you try to cool them down, but and how do you do that? And what's the treatment?
Yeah, I mean, ultimately, you try to kind of bring their body temperature back down to a more normal range, and oftentimes just getting somebody into air conditioning, which I think I can say with a reasonable degree of confidence that all of the emergency departments in the Mayo Clinic health system are air conditioned. Just getting them into some air conditioning, with no humidity, will oftentimes kind of abate some of those symptoms. But oftentimes, like I was saying, there's a concurrent issue going on with some dehydration, and so oftentimes these folks need IV fluids, and they need to be monitored. Typically, these people will get some blood work and be monitored closely for a period of time.
What about so that people don't have to come to the emergency room to see you? If you're out at a kid's ball game or you're running at a 5K or whatever, how can you recognize that you're starting to have some heat-related issues?
Sure. Yeah. I mean, oftentimes for kind of early heat exhaustion, some of the symptoms are fairly vague, but some dizziness, some nausea are kind of oftentimes the first symptoms. Oftentimes a headache, and so really good hydration, and then staying out of the heat as much as possible. So finding some shade, finding some air conditioning if you're starting to feel those symptoms, and then really starting to drink lots of fluids. And I'm not talking about Pepsi or anything like that. I think clear fluids is kind of ideally what people ought to consume in those situations. Oftentimes when people run into dehydration in the emergency department and I'm sending them home, one hydration strategy that I'll kind of suggest to them is if they buy a bottle of the powdered Gatorade and then make that kind of at half strength, gives them some electrolytes, gives them a little bit of flavor, and I find people kind of will be a little bit more mindful of how many fluids they're taking.
All right, emergency room physician Dr. Luke Wood, great to have you with us. Time for a short break.
When we come back, myth or matter of fact, kids need to wait 30 minutes after eating before they swim.
It was an hour when I grew up.
Yeah, we'll find out. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We are with ER Doc, Dr. Luke Wood. Dr. Wood, great to have you with us. We're going to start off with a myth or matter of fact.
Kids need to wait 30 minutes after eating before they swim. Dr. Wood, is that a myth or is that a fact?
Ooh.
Ooh.
I'll go with fact.
Okay. Because?
Really? Well, the theory is that at least my understanding is that kids can kind of develop a side stitch or kind of a cramp, which can impair their ability to swim. I don't think I think 30 minutes is probably a little bit on the generous side. I'd say, I'm guessing more so kind of 10 or 15 minutes would be a little bit more along the lines of reason.
Yeah, well, you know what? I thought you were going to say, no, you can go right in the water after you eat. I mean, theoretically, is it that all the blood flow of your body is going to your stomach to help digest your hot dog? And that's why your muscles aren't working so well, or what's the reason behind it? I mean, when I grew up, it was 60 minutes. My mom wouldn't let me close to the water for 60 minutes.
She loved you very much.
I know I did, but she's the reason I survived.
Like I said, I thought that the kind of issue was that kids can develop kind of abdominal cramps or kind of side stitches when if they go in the water right after they eat. I don't know. I guess I've never taken care of a patient in the emergency setting who's run into this particular issue.
All right. Well, let's talk about helmets. I bet you have had that issue come up. For kids and adults, helmets are mandatory.
They're mandatory in my book. You know, I'm an avid bike rider, so I think the importance of helmet use can't be really emphasized enough. You know, specifically for bike riding, oftentimes what happens, especially with little kids, is you've got kind of a collection of helmets in your garage, and in the springtime you go out and you start trying out which one seems to work this year, and it's really.
I'm sorry, which one looks the best?
Or what? Yeah, sure. That's the more important thing.
It used to be which one felt the best, but now it's which one looks the best.
But a proper fit certainly is necessary. You don't want that helmet kind of jostling around on top of the kid's head. It's always a good idea to kind of go in at least maybe one time during the season, especially kids who are growing like weeds, to make sure that their helmet's fitting properly. Really, any of the local bike stores can help you out with that. I do think that a good helmet is a very worthwhile investment. If you actually make an in-store purchase instead of purchasing it online, you can make sure that it's fitting your kid properly, and you know, then the sales agent can make sure that it's appropriately sized.
You better stick with the exercise cycle.
Oh, very good.
I think. So let's talk a little bit about drowning. Especially in the summertime with a little bit of alcohol on board, it's a not too uncommon problem. And then there's this issue of dry drowning, which I actually hadn't heard the term used before. What's dry drowning?
Sure. Well, this particular issue has kind of received some attention lately because of some unfortunate events that have occurred around the country recently. But dry drowning is this idea where, you know, typically a child will survive a near drowning incident, and then they'll develop some respiratory failure, either hours or days on down the road. And there's really kind of two different processes that are ongoing, both of which are extremely rare. And I think it's important that listeners understand that these events truly are rare. But with a dry drowning, essentially what oftentimes happens is a little bit of fluid hits the vocal cords, and then those vocal cords go into spasm. Several hours to days later, there can be kind of an inflammatory reaction that exists down in the lungs that causes some respiratory failure. Again, typically occurring you know, around the time where the initial near drowning incident happens, but you know, kids or adults can become sick in the hours or days leading up to the event or following the event.
So if there is a near drowning, that is something that you want to watch out for in the coming days that follow.
Sure. I mean, you know, anytime there's a near drowning incident, I don't think it's a bad idea to come into an emergency department to be evaluated. Generally speaking, when people feel normal after a near drowning incident, they regain consciousness, they're acting like themselves, and they're not having any respiratory symptoms. Almost all the time, those folks are generally out of the woods. There are these rare cases where people will go on to develop some respiratory issues later on, but that's either because of that dry and drowning incident, or sometimes if people aspirate some fluid at the time of their near drowning incident, that can cause an inflammatory reaction in the lungs that again can develop some issues in the days following near drowning event.
So you get the water, contaminated water, swimming pool water with chlorine in it, down into your lungs. So you basically aspirate.
Correct. Yeah.
And then what was the other cause of dry drowning that you mentioned?
So there's
two different things.
Yeah, there's kind of two different things. There's the whole idea of dry drowning, which is where the people have spasm of the vocal cords.
Oh, so you can't breathe.
Correct.
Okay.
Correct.
The vocal cords come together and block off your airway.
Correct.
Okay.
And then there's this whole idea of secondary drowning, and a lot of medical sources are kind of getting away from the terminology secondary drowning or dry drowning. But in this kind of secondary drowning, that's when there's a generalized inflammatory reaction in the lungs, usually due to some aspirated water of some sort.
Dr. Shives also mentioned alcohol, and you could say the effect of alcohol with swimming or boating or fill in the blank. I mean, how does alcohol have a special danger element to swimming? Is there anything?
Good question. I mean, it's certainly one of the most closely associated risk factors with drowning incidents. And oftentimes we see kind of two age groups that are particularly affected by drowning. Kids less than 5 years of age, and that's often because of lack of parental supervision and a variety of other reasons. And then also kind of in the 15 to 25 age range for males, and that's oftentimes when alcohol is involved.
All right, we're coming up on July 4th. Are we going to air this program before July 4th? All right, so we got to ask you about fireworks. Tell us about, we all know that alcohol is sometimes involved again, or not infrequently involved. Tell us about one of the more interesting fireworks injuries you've seen.
Well, that's a good way to put it. I'd say, or 12-year-olds are involved. There's fireworks injuries all over the place.
Well, let's see here. Before moving back to Minnesota a few years ago, I was practicing emergency medicine out in Maine, and I was practicing kind of in the rural part of Maine, and we had a really wet and rainy 4th of July one year, and one individual had decided to take a whole bunch of fireworks and duct tape them together and then twist the fuse together and then cut the fuse short. It didn't go well for him. And so, common sense is really kind of important with fireworks. Certainly, you kind of hit the nail on the head that alcohol is oftentimes involved, but oftentimes it's from either user misuse of the fireworks or from like a faulty igniting system with the firework.
So the thing blew up quite close to him.
In his hand.
Oh my.
Yeah, that's
we have
a 5-finger problem.
Just a few moments left. What would be the last piece of emergency room expert advice you want to share with our listeners?
Well, I think common sense. We see kind of two varieties of summer-related issues in the emergency department: mild ones, which sunburn, heat exhaustion, poison ivy, that type of thing, and then more major ones. And so, if there's anything I can emphasize to the listeners to try to minimize your risk to those kind of more major events, and so helmet use, avoiding alcohol when you're operating motor vehicles or when you're in the water, especially with little ones, we touched a little bit on ATV use. We always see every summer a handful of patients who end up getting really injured using ATVs when they don't really know how to, or if they're using them after night and they're not really a proficient rider. And so whatever you're doing, certainly use your brain and then protect your brain with the helmet.
All right, we've been talking about summertime safety, and just because it looks pretty doesn't mean it fits right.
I like
Tracy.
that. Protect your brain with a helmet.
We've been talking about summertime safety and drowning with ER physician Dr. Luke Wood. Thanks so much for being with us, and safe summer, everybody.